Okay, and we're going to get started with the videos that our patients have been requesting regarding the neck stretches and acupressure points. First, I just want to start with our patient volunteer today and show the deviation of his head slightly to the right and the drop on his left shoulder. We're going to continue with the neck stretches. First, we're going to start with patient's right shoulder and neck. The reason that we focusing a lot on the neck stretches is because all the muscles of the base of the skull and the neck are all interrelated, and as you get older you tend to roll your shoulders forward as well as upward, which then is pulled up by this whole system up here, which is all your neck muscles together with your masticatory muscles, and that's not because of age alone, but is contributed to a lot because of the muscles shortening as the posture changes. So by stretching the muscles out, we increase the range of movement and the range of motion of those joints. So we're going to start with the right side here. What we're going to do is we're going to get our patient to put your hand under your right leg. And that the reason we do that is the side that you're going to be keeping down, we lock the shoulder in place. That way, when you're doing a stretch, if you do this, that's not really stretching because the shoulder is coming up. Whereas if you got the shoulder locked down and then you pull, you can feel that stretch is a lot more pronounced. Then you take your left hand, put it over your head, and very gently pull to the side. And when you feel the pressure, just stop there. Can you feel that? And then we hold that for 1 minute. Okay, and then we let it go back very slowly. So that was the first stretch. The second one, we're going to focus only on the right shoulder. Next, what we're going to do is we're going to come backward. Now, we don't want to put pressure on the back of the neck here. What we're going to do is to come back and at an angle, gentle pressure, no firm pressure. Just feel as soon as you feel the pressure, just hold it there for a minute. Can you feel that?
Mm-hmm.
And next we're going to go to the opposite direction. So we're going to go down and forward. So we'll take your left hand and put it up over here and very gently pull in that opposite. Can you feel that stretch down there? Yeah. And you can see that that is where you generally get those headaches that come at the base of your skull, or where your neck and your head meet. when you're doing these stretches, the most important thing is to keep deep breathing. That means in for 5 seconds, out for 5 seconds. Nice deep breaths. Okay. Yeah. And after 3 minutes of the neck stretches, you can see our patient's right shoulder has come down a bit and his head is still deviated to the right, but not as significantly as earlier. Stretches. The next thing we're going to do is the acupressure points. So we're going to put pressure, and a lot of you would find that if you don't get headaches anymore, it's more than likely you've gotten used to the pain. So what you want to do is pay attention to if you get pain behind the eyes, or if you get ringing in the ears, bit of vertigo, or even tightness when you wake up in the morning. You feel it's tight and you got to stretch your jaw. That's an indication that it's your jaw muscles have been working throughout the night. So what we want to do is to relieve the spasm the muscle is in. So what you do is you just take your hands very gently, place it over the corner of your jaw, which is just here, and you get the patient to just squeeze your jaw together there for me and relax. And you can see how it comes in and out right there. That's because of the muscle spasm. So what we want to do is go ahead and put as much pressure that as you can cope with, and hold that pressure on there for 1 minute. The exact same thing we want to do up over here in the temporal region, which is if I get you to clench your teeth together, you can see that the muscles are doing that. And I'll get you to just squeeze your teeth together. And the muscle is more to the side of here, and that's in spasm. The muscle extends in a fan fashion over here, but the part of the spasm is in a certain part of the muscle that's being overworked, and that's where you want to put the pressure to alleviate the spasm the muscle is in, which would then take the pressure off the teeth, take the pressure off the jaw joint, which is when you squeeze the teeth together, you close the space for the jaw joint. When you close the space for the jaw joint, inadvertently, you close the space for the eustachian tube or the hearing canal, which then causes sometimes tinnitus or ringing in the ears, or even vertigo. So that's the acupressure techniques and the neck stretches that we want you to use once in the morning, once in the evening, just before going to bed, and check with your therapist if you have any medical conditions or concerns regarding your neck problems or shoulder problems, so that you don't compromise these joints. Thanks.